Good morning, guys, and welcome to Unique Not Different with me, Shamla. And I have on the phone the Honorable Minister, Mr. Terence Dial Singh. I reached out to him yesterday evening, and I am so grateful to have him on my segment. Good morning, Honorable Minister.
Good morning to you. Good morning. Good morning to all your viewers and listeners.
Thank you. How are you doing?
I am quite well, quite well.
Oh, I thought you was going to say tired. But
No, no.
all right. So let's get straight into it because what I want to focus is nationally and then go down to persons with disability because as you may be aware that this segment deals with persons with disability. But before I go into that particular, segment, I want to ask in terms of the curve, right? I know people should be aware of the curve by now and,
Yes.
the flattening of the curve. But we constantly seeing like every day or every 2 days, someone else being contacted with COVID. So at what point, in terms of, not with respect to the curve, but with respect to numbers, at what point on the curve or the numbers, would you say that your system in terms of, because rules were put into place and guidelines, and in certain aspects, these rules were made mandatory, like for rum shops and so on, bars. So at what point in the curve would you say that, okay, 10, 12, 15, that this would be a national emergency where the country in itself would be on a lockdown? Because we see other countries on total lockdown.
So the government has already treated it as a public health emergency.
Right.
And that is why we took action since January 30th when we imposed the first travel restriction on China.
Yeah.
If we didn't do that right now, our hospital system would have been flooded and
Yeah.
the hospital system would have collapsed. It is because we did that action on January 30th that we were able to buy a lot of time to set up a parallel healthcare system in Hoover and Cora, specifically for the treatment of COVID patients, so that our regular hospital system continues to run. People get their normal service without any disruption, and COVID-19 patients are treated in Hoover and Cora as a parallel system. That is how you flatten the curve.
Right.
And you don't end up with your hospital system being totally
Overcrowded.
flooded and overcrowded.
Right. And I have a question. In terms of
Sure.
Cora Hospital, right? I know that they treat patients with tuberculosis. And obviously, this is an obvious question, but I want to ask you how, in terms of segregating or isolating the tuberculosis patient and the COVID patient, because both are respiratory, right?
Yes.
How are they being isolated at the Cora Hospital?
You are asking all the correct questions. But it's really a breath of fresh air to be questioned and not asked to repeat the same things I have said
Right.
1,000 times before. Congratulations, well done.
Thank you.
So, in Cora, the tuberculosis wards are totally separate and far apart from where we are treating the COVID-19 patients. So
Right.
there's a total separation. There's no mixing. There's no intermingling. It's a complete, total separation of the facility.
Understood. In terms of
And that's why we chose Hoover too. So we are not treating COVID-19 patients in your existing facilities.
right,
Because you have to see what happened in Italy when they had to treat COVID-19 patients in their existing facilities. They just led to a total collapse.
yeah, and in terms of private sector, right? In terms of private institution, what would you advise persons? Because I don't know if it's rumors, but a lot of rumors are being spread, and I think something should be done about this. But a lot of rumors generally are being spread, and I saw people say that people are being isolated in private institutions. Is this true? And are private institutions equipped to deal with COVID patients?
The only way a private institution can deal with a COVID patient is if they have separate isolation rooms. And I am not aware that they do,
Right.
But to treat a COVID-19 patient, you need different protocols from treating a regular
Exactly.
internal medicine patient. So my gut instinct will tell me they are not equipped to do it. That would be a public
Yeah,
sector.
because persons actually spreading this on social media that
Yeah, there's
they
a lot of misinformation on social
right. So
media.
that is why I asked you, so the
Yeah,
public could be aware
yeah.
that this isn't true, and
Well,
even if it's true, it's not protocol.
again, you are asking the right questions.
Right. In terms of transport now into, getting the COVID, because there are patients who need to be transported by an ambulance,
Yeah.
right? Are these ambulance separated, or in terms of, because obviously we still have different medical issues if we deal with emergencies that require ambulance. Are they are there particular ambulances that being put separately to deal
Yeah.
with COVID patients, or are they being sanitized and used
Yeah.
generally
So
after?
any ambulance that is used to transport a COVID-19 patient
Mm-hmm.
has to be sanitized as per
Right.
protocol,
Yeah,
as we do for any infectious disease.
yeah,
So it's not only for COVID-19. Any person we transport in an ambulance that has an infectious disease like tuberculosis, HIV, anything, is automatically sanitized.
right.
We do have, I believe, two special ambulances with
Mm-hmm.
GMRTT with what is called isolation pods in them. So it's like a big plastic tent,
Right,
and you put them inside that, and you transport them. So we
right,
do have protocols in the ambulances for transporting patients.
right. One last question before I get into persons with disability. In terms of the protective services, obviously they have to work. They have to be in the community, and be all around. Um, uh, Besides, maintaining proper protocols like sanitization, washing of your hands, etc., etc. Protective gears being offered to them in case of a massive outbreak and stuff like that.
Yes. So the minister, you will notice whenever I have a press conference,
Mm-hmm.
the Minister of National Security is always right next to me.
Yes.
We are now the co-pilots in this, and we report to the captain, who is the Prime Minister.
Right.
So I'm just using that analogy. So
Yeah.
the Minister of National Security is always informed of everything we are doing,
Yeah.
and the day we have to use his forces, we have everything in place for PPE in the unlikely event we have to use his forces.
Right. Yeah, because everything is codependent, and I was trying to segregate, health and
Correct.
security and so on, but I know everything interlinked, and you all will be in
Correct.
constant conversation. Okay,
What a
so
pleasure to be interviewed by you this morning.
thank you. And in terms of person with disability, because I know time going, and
Yeah.
I request a certain amount of time from you. So in terms of person with disability, right? There's behavioral disability, cognitive disability, persons with
Yeah.
autism, etc. In case they get infected by COVID and they reach a point that they have to be hospitalized, are there provision in place in these designated facilities to, handle these persons with disability, whether physical or cognitive, behavioral, etc.?
Yes, that is a good question, because we have to look at all the subpopulations that may get infected.
Mm-hmm.
So people with disabilities, yes, we have considered that. So we have
Yeah.
all the wheelchair ramps, those are with physical disabilities.
Mm-hmm.
With cognitive disabilities, we will have to bring on psychologists, psychiatrists, behavioral key people to help them through all of this.
Right.
But
Mm-hmm.
before we even get there,
Mm-hmm.
I would like to tell people with disabilities, what you have to do now is isolate yourselves.
Yes.
The best thing you could do is protect yourselves from not getting the virus.
Yeah.
Isolate yourselves,
Yeah.
because you will be at special risk, especially those with physical disabilities.
Mm-hmm.
Your immune system may already be depressed.
Actually, I don't go doctor, so I
Yeah.
don't know.
Yeah.
I never go
So,
doctor.
this special category of persons, yes, we have considered them in our treatment protocol,
Right.
but I don't want to have to treat any of you wonderful people.
Mm-hmm.
So don't get sick, don't go out, isolate yourself.
Right. And
That is best advice.
and in terms of caregiver, because even if you have a psychiatrist in, right, the person, like for example, a person with autism may throw a tantrum when they see somebody with a mask coming
Exactly.
in. And you know, to have the caregiver in, and what protocols or what plans are being placed to say, let's say having a parent in there, and those practitioners aware that, okay, how to handle the situation, what,
Sure.
you know,
Okay.
automation to give to the parents, etc., to deal with it.
Lovely. So if we have a child under 18 who develops COVID, in a normal hospital setting, parents are allowed to stay with that child for 24 hours, right?
Right.
In a normal hospital setting. However, for COVID, the protocols are going to change. No one, no caregiver, unless it is absolutely necessary, will be allowed to stay with a COVID patient because of the possibility and threat of infection. Because remember, when you are treating a COVID patient, you have to have a professional who has been trained to wear PPE and how to act and behave around an infectious disease patient.
Yeah.
So we may not allow parents, that would be the treatment of a positive COVID-19 patient for somebody with autism or something has to be under the guidance of professionals.
Okay, so I know, time is running out, but I just want to say that probably after we go through this phase, probably something should be in place to have parents deal with, have training with those PPE and HSE, etc.
Well, that is a risk I am not willing to take right now.
Yeah.
We have to safeguard the health, because if a parent accidentally becomes infected, it means that parent goes home,
they would
infects
infect
the whole
others.
community. It's a risk I am not willing to run. That is one request. Most respectfully, I will have to decline.
Right. Okay. So just to close, right, I'm just going to ask you two questions in one. I know there are persons, the problem is not persons being infected per se, because death rate are low, although death rate is death rate and that's tragedy. But the problem is we're trying to minimize it and isolate persons in order so the healthcare system won't be swamped, right? And there are persons who are susceptible to this that will lead to them dying. Are there data available within the ministry to know, okay, there are 10% of the population that is 80 years and over, 2% that is diabetic, etc., to know, okay, we are dealing with this situation?
Yes, so we have all the data on what diseases the population has.
Right.
Now we are moving to collect data on COVID. So we have brought in, as of yesterday, data collection people, epidemiologists.
Very good.
So as we roll out the plan now, and we are actually tracking our COVID-19 patients and their contacts on a GIS system.
Yeah.
So we know in real time where these contacts are, where they are being isolated,
right,
so we can monitor them. So you are spot on.
Right, and I have so much questions there, but I now have to go. But okay, right. So just one last thing, right? So I know Jamaica got a case from our country, right? So when you guys get that information, do you guys now track to see, okay, they come from here, who they went, who they came by, or who is the family, etc.?
Yeah, that is called contact tracing, and that is what we do, and it's plotted on the GIS. Correct.
Right, good. And finally, what would you like to say to Trinidad and Tobago in terms of, not being prepared, but especially millennials, to follow the rules?
Right. So, especially to millennials, because my two children are millennials, this is going to affect your social life.
Right.
So, because we have to get accustomed to something called the new normal. What is the new normal? The new normal is all the linemen and so on have to cut out for the time being. Yeah. That's why we closed down bars yesterday.
Which is a good thing.
The new normal is no close contact. The new normal is you have to wash your hands 1 million times a day.
Right.
Not touch your face. How you cough, how you sneeze, how you protect yourself by by self-isolating, avoiding crowds. That is how society now, regardless of whether you're a millennial, a person with disabilities,
Yes.
all society, all of us, healthy, unhealthy, have to adjust our lifestyles for the foreseeable future to prevent the spread of this virus.
Right, and with that being said, Mr. Minister, I just want to tell you if you could communicate with, the Minister of Public Utilities and tell him if you could just distribute water a little more often and be more manageable, because in my area it's terrible with respect to water. And with that being said, I want to say thank you so much for coming on
I
Unique,
want
Not
to
Different.
thank you. This is one of the better interviews I have done. You have asked questions that no one else has asked.
And I have so much more in my mind, but I know
It was
unfortunately it's TV and we have to be way out of time.
It was refreshing. Thank you very much.
We do have some more time, so Shamla, if you have a few more questions, we can take.